So, hi everyone. I'm Vineeta Ahuja. I'm a cardiologist from Toronto, Canada. And I have here Sahil Langar, Dr. Sahil Langar, who's moderating, Ayurveda graduate from Jammu Kashmir. I'm sure many of you know him. So we're going to talk about Ayurveda and allopathy in cardiac disease today. Ayurveda, of course, I know a lot of you are studying this right now. But I'll give you some sort of correlations with allopathy as it is in cardiac disease. The date here says 2018 because I had previously presented this in Canada to some of our early Ayurveda graduates. But I've added a few things here. So we know that heart disease, at least in Canada, and I think this is similar in India, although there are other infectious and other causes on the list as well, is the second leading cause of death in Canada after cancer, which is quite profound, has a huge impact on the global health system as well as the Canadian health system, which is, as you know, a sort of a socialized medicine healthcare. Globally, it's responsible for 50% of deaths from non-communicable causes. Of course, COVID is not included here. And by the way, I hope everybody's staying safe in the lockdown and safe at home, taking advantage of the lockdown to better ourselves. I don't think we'll have such an unfortunate opportunity again in a long time, hopefully. So we know the physical heart is Sadhya Pranahara Mama. It's the size of one's fist. This was said by Bhagavat in 600 AD. And we know that 85% of diseases of the body and mind do not require a doctor. This was said many years ago and can be managed through dietary and Ayurvedic principles. Chakrapani in the 11th century also said that the heart is likely the size of 2 fingers. And as you know, with the West, always likes to correlate things with science. And this has been shown in autopsies as well, that your heart is in fact, as long as there's no other pathology, the size of one's own fist or the size of 2 of your fingers. We know the heart, the Hridayam, as it's spoken of in Ayurveda, is the seat of prana and ojas. It involves also the physical heart and the emotional heart. It's governed by 3 subdoshas as well as the basic elements, including rasa, rakta, mamsa, meda, the ojas, and pranavayu, as well as sadhaka pitta, which governs emotional balance, ambalaka kapha, stability and strength, and vyanavata, the blood flow and the beat of the heart. The Hridayam, we know, has 3 vital functions. The harati, dadati, and yati. It collects the blood, gives the blood, and then circulates the blood to the entire body. Embryologically, we have 3 layers of the heart: the endocardium, the myocardium, and the pericardium. The endocardium is derived from rasa, or body fluids, and rakta, which is the blood, and that is the innermost lining of the heart structure, here, the entire inside of the heart. The myocardium, which is the entire muscular structure, is derived from mamsa dhatu, the muscle tissue. And the pericardium, which is the outer layer, the thin outer layer of the heart, the sac as we call in allopathy, is derived from meda dhatu, the fatty and connective tissue. The equivalent in modern medicine, of course, the classification of diseases of heart are similar in both Ayurveda and modern medicine, with a few exceptions. We look at categories such as hereditary disease, metabolic, or glycogen storage disorders, for instance, that are inherited through your ancestors or family members genetically. We then have congenital causes, which occur from the stage of conception through the period of pregnancy and occur and are diagnosed usually late in pregnancy or at the time of birth. And then we have the doshas, of course, the dosha rogs, which are vata, pitta, kapha, and sanapataka, which is a combination of the 3 doshas within the illness. In allopathy, we could say that the vata aggravation is similar to what you would see in patients who have anxiety, depression, pitta, what you would see with inflammation, and kapha, perhaps increasing mass and enlargement of the heart, etc. You may have traumatic or poisoning causes, environmental or seasonal causes, infectious diseases such as endocarditis, myocarditis, and pericarditis, which is infection of one of the 3 layers of the heart or all 3. And in fact, I don't know how many of you may have seen this, but in the COVID patients that are very sick, it is not only respiratory illness requiring ventilation that is occurring, but oftentimes in the absence of any respiratory illness, they are presenting with clotting disorders or significant inflammation of the heart structures. Oftentimes myocarditis, pericarditis with very high troponin levels, troponin being a biomarker of cardiac injury. And oftentimes this is mistaken, and in the early stages of detection of COVID, the COVID testing was not being done, and this was presumed to be a primarily cardiac illness, however, later discovered that it was COVID related as well. The natural diseases such as aging and death, and of course psychological factors can cause heart disease and hypertension, as I previously mentioned, anxiety and depression, or significant emotional stressors. One such significant emotional stress commonly seen, it has actually been coined a term, Takotsubo cardiomyopathy, based on a Japanese discovery, that the heart would suddenly, the left ventricle in particular, would suddenly become severely dilated immediately after a period of profound emotional stress. The natural history of this is spontaneous recovery, but it can lead to chronic cardiomyopathy if not treated. There are also idiopathic causes, and this is thought, at least in Ayurveda, in the spiritual realms, to be due to the actions of previous karma, previous lives. So of course, in every method of medicine, we want to take a very thorough history. In doing so, we try not to bias the patient by inserting answers or to the questions that we presume might be occurring. We allow them to speak in thoroughness so that they can themselves reveal to us the cause of their disease, and they will often do so. There are 5 types of Hridaya rogas: the Vata, Pitta, Kaphaj, and Sanipataj, where all 3 doshas are present, as well as Krimi, which is the sort of infectious or parasitic mechanisms. In Vata, these are some of the symptoms that you might see: severe pain, tearing or pricking pain over the cardiac region. You may have fainting or circulatory collapse, significant lowered blood pressures, higher heart rates or fibrillation, atrial fibrillation, for instance. You may have heart failure, which is a dilated heart muscle, the inability to bear loud noises or aggravations of sound and voice. You may have trembling, twitching, or sudden onset of sweating, which we call diaphoresis. Again, fainting or loss of consciousness, jerks or breaks in the motion of breath. A patient may say to you, "I'm not sure what happened, but suddenly everything stopped," and they can't explain where this is coming from. They may have a loss of sleep, insomnia, fear, difficulty falling asleep, etc. The Pitta Hridaya rogas are thirst, vertigo, unconsciousness, gastric reflux, vomiting, pallor of the body, and of course fever, which is usually related to the inflammation of the various cardiac structures. This, by the way, can also occur in the arterial structures of the body, where you have arteritis or inflammation of the arteries. Kaphaj Hridaya rogas are symptoms are failure of the normal motion of the heart, a decreased heart rate or bradycardia, as we call it in allopathy, a heaviness or dullness sensation in the body. Of course, weight gain we should add in there as a cause for some of these pathologies as well. A sensation that there is something stony in the cardiac region, a cough, a loss of appetite, excessive sleep or lethargy, anorexia, and fever. Some examples of these, if involving the endocardium, where you have Vata predominating, you may see aortic and mitral stenosis or regurgitation. These valves become calcified, of course, with aging, and we know aging has a predominance of Vata aggravation. You may in Pitta see endocarditis, which is inflammation of the inner lining or the valvular structures within the heart. This could be infectious or non-infectious. We may have Kapha aggravations, which cause endocardial fibroelastosis. And as you may know, this may be caused by some of the infectious causes as well, parasites, which lead to what's called as Loeffler's endocarditis, and subsequently fibrosis of the inner lining of the endocardium. The result is that the heart becomes very stiff to relaxation, is able to contract fully, but not relax, and you get what's called a restrictive filling defect. The myocardium, again, which is the muscle of the heart, in Vata aggravations, you may see atrophy or fibrosis. You may see dilated cardiomyopathy, which is enlargement of the left ventricle. In Pitta, you may see a myocarditis again, which is inflammation of the heart muscle. The patient may present with fever, pain, troponin elevations, and often severe pain with different positions of the heart, of the body. In kapha aggravations, you may have a thickening of the left ventricle or right ventricle, or any portion of the heart for that matter. You may have ventricular hypertrophy. This may also be seen with other infiltrative disease such as amyloidosis or glycogen storage defects. In the epicardium, the vata aggravation may present as a pericardial constriction, where the outer lining of the heart, similar to the valves with aging, the outer lining can become calcified. Usually this does not occur with age, however. This occurs with other pathologies. Usually a previous pitta inflammation of the pericardium can lead to a chronic inflammation and subsequently down the road pericardial constriction with a vata predominance. And in pitta, of course, preceding this, we have the inflammation of the pericardium, which is pericarditis. And again, similar to myocarditis, the hallmark is the patient may have symptoms with different postures of the body. Forward leaning, for instance, where the heart is brought closer to the sternum, may produce significant pain. This may also be associated with certain cardiac arrhythmias, dysrhythmias, because as you know, the endocardial or the epicardial lining is directly related to what we see on our ECG, and it's layered right across the myocardium. And so inflammation in the epicardium may indirectly affect the myocardium. In kapha illnesses, we have pericardial thickening, which again may be a precursor to later stage pericardial constriction. Sanipataj Hridaya roga is usually present if you have symptoms of all three doshas in varying degrees of severity. One such example, you may have a patient with left ventricular hypertrophy who also has mitral stenosis. The mitral stenosis causes narrowing of the mitral valve, which is a vata predominant issue, and this results in enlargement of the left atrium, and down the road perhaps other pathology such as atrial fibrillation. And the patient may concomitantly have myocarditis, which is a pitta aggravation. So you may have all three present in one patient, not that they are all of the same cause, but may have some correlations. Crimage, you may see blackness around the eyes, darkness in front of the eyes, atrophy, itching, excessive tension in the heart, and a throbbing or ripping pain. So of course, similar to the history, we want to make sure that we take a thorough physical examination. And we know in every type of medicine, again, that the physical examination begins when the patient enters your room. As soon as you lay eyes upon them, you are watching their gait, you're watching their appearance, you're noticing if they're unstable, if their breathing is labored, if they're sweating, alopecia, if they've had dry skin, etc., etc. So you want to begin, be very observant from the get-go during your physical examination. The Hridayam is one of the Trimarma, it's one of the vital organs, and we look at the other two, the Shira, the head, and the Basti, the bladder or kidney region. Deterioration of any one of these will result in instability in the entire body, and they must be nurtured at all times. This is the seat of Rasavaha and Pranavaha Shrotas. It's the seat of Sadhaka Pitta and Ojas, and it's a Gulmasthana, a ball of dosha. The Hridaya roga should be treated with, therefore, a vision of Sutta, Udvartha, Gulma, and the Trimarma. The Vega Dharniya produces heart disease through an aggravation of Udvartha by affecting the autonomic nervous system. And this must be kept in mind, and it is for this reason that the Hridaya rogi are fit for Samana Chikitsa, which is the alleviating or palliative treatments, and mostly not for Shodhana Chikitsa, the elimination therapies. Again, I'm going to bring this back. The heart is governed by the three sub-doshas, the Sadhaka Pitta, Ambalaka Kapha, and Vyana Vata. We must balance the sub-doshas, of course, when treating any diseased heart condition. So it's very important to nourish the Soma, nourish the Ojas, pacify Sadhaka Pitta, stabilize Avalambaka Kapha, and balance Vyana Vata. And of course, these are just a non-exhaustive list of some of the herbs and therapies that are used in the various conditions. We know that Arjuna, a very popular herb for cardiac conditions, nourishes the physical and emotional heart. And we know that Google decreases cholesterol. often used in combinations with other therapies with the appropriate anupan. We know vata aggravations may lead to high blood pressure, pitta diaphoresis or sweating and excessive heat, and kapha elevated cholesterols. In allopathic medicine, we describe a few stages of cardiac disease, those that are at risk. In other words, they have no current evidence yet of structural heart disease or heart failure. They may have precursors to developing cardiac disease or significant risk factors, which include diabetes, hypertension, obesity, smoking, or hyperlipidemia, but they may not have yet developed the disease. And of course, Ayurveda targets the risk factors aggressively at the early stages, well before development of more vitiated situations. In structural heart disease, there are no symptoms yet, but you may have, once the patient has developed something, you may have a myocardial infarction, ischemic heart disease, or other arrhythmias. And then as this progresses, you may have further structural heart disease as a consequence of the myocardial infarction, for instance, where you've had a blocked artery which damaged a significant portion of the left ventricle. You may then have a dilated heart, which leads to heart failure, shortness of breath, edema, fatigue, and then subsequently end-stage heart failure. So 7 common sense ways that we can keep our hearts healthy. We must, of course, soothe away the stress, cultivate positive thoughts, eat right, eat mindfully, cleanse ama from the physiology on a continuous basis, exercise moderately and regularly, and of course, get your Z's. So I'm going to end it there. And I think we'll take some questions. I'd just like to thank Dr. Sahil Langar, who is organizing these various talks for you. And I admire how he is continuously looking for new ways to enhance his own Ayurvedic practice in Jammu. And I think he was just talking to me today about some newer things that he has in the works. Dr. Langar?
Yes. If anyone have any questions, they can ask. And this is only the basic about cardiac disease. Okay, ma'am will take the elaborate session in the coming weeks. So anyone have any questions, they can ask in the chat box.
What can be the cause of cardiomegaly? Okay, hi Shashwat. Yeah, good question. So cardiomegaly, by definition, implies enlargement of the cardiac structures. It usually relates to either the left ventricle enlargement or the right ventricular enlargement. And there are numerous causes. As I was alluding to earlier, the breakdown or classification of diseases can be hereditary or congenital, environmental, iatrogenic, etc. So cardiomegaly is sort of the end cause of one of those etiologies. So for instance, you may have somebody who is born with some cardiac pathology, such as an abnormal valve or a hole in the heart or an ASD, VSD, for instance, which then results in an overload of pressure in one side or one chamber, and this can result in enlargement of the heart. You may have hereditary causes such as genetic causes, which are transferred down from family to family, resulting in a mutation of one specific gene, which can then lead to, usually in the 3rd or 4th decade, slow enlargement of the left or right ventricle. You may also have infectious causes. Alcoholism as well can cause significant cardiomegaly. And the end stage of untreated hypertension, which usually first begins with hypertrophy and in later stages results in enlargement of the left ventricle, can also occur. You may have a massive MI resulting in a blockage to a coronary, resulting in significant damage to a certain portion of the left or right ventricle, and subsequently that muscle may be scarred and may never recover, and as such the left ventricle again becomes dilated. And when looking at valves, for instance, these are just some examples, but you may have a significant regurgitation in mitral, tricuspid, aortic valves, which leads to volume overload and subsequently again enlargement of the left ventricle. So as you can see, there are numerous causes of cardiomegaly, but it's important to keep it organized in your mind and to use the breakdown of when you look at the etiology of any cardiac disease, go through each one sequentially, and you will find the cause within those categories. So I'm gonna put this question to Dr. Langar about the Arjuna in clinical trials. At least in the West, I haven't seen Arjuna in a clinical trial here, but of course we don't have it as readily available.
Actually, if I say about my practice, I have given to many patients. and I have got very good results in case of not just in case of hypertension, which is also related to that cardiovascular disease, but I have seen results in other cardiac disease. In, for example, heart blockage also, I have seen good results of Arjuna Shirpak also, and Arjuna Wrist also. And sometimes we give Arjuna tea. There is a Arjuna tea of that is our Pranada Ayurveda formulation that we give in case of high cholesterol, and within a month or within 1.5 months we got good results in high cholesterol patient.
Amazing. So then we have a question from Mega. Can we compare pericarditis, other inflammatory conditions of the cardiac, with crimmage hridroga? So pericarditis, it is occurring, I think, more commonly in tropical countries in the setting of significant infection of the pericardium. You may have viral pericarditis. You may have other parasitic types of illnesses as well. But there's also an inflammatory type of pericarditis, which usually occurs after an initial infection. So you may have a viral infection, and subsequently the pericardium becomes inflamed. That patient then is predisposed to repeated bouts of pericarditis in the future. Another type of pericarditis is that which occurs after instrumentation of the pericardium, for instance, after a coronary artery bypass surgery, where we tear through the pericardium to access the cardiac structures. Once everything is healed and the sternotomy is resealed, oftentimes for a period of 4 to 6 weeks, a patient may have significant inflammation of the pericardium. And that type of pericarditis associated with what we call Dressler's syndrome is associated with fever and pain. And sometimes many years down the road, the patient has persistent or chronic pericarditis, and this may lead to pericardial calcification and subsequent constrictive pericarditis. Akansha, is there any emergency treatment in Ayurveda for an MI? So again, Dr. Langer, I'll pose this one to you.
I never tried. So I don't know.
Yeah, it's difficult. It's very difficult. I think at that stage, the patient has significant disease, and probably the best thing you could do is be very supportive with any treatments that you give. You know, provide symptom relief, provides stabilization of the vital signs, similar to what we do in medicine. Again, aside from instrumentation and removing the clot and restoring blood flow, it may be difficult to tackle this through purely an herbal form on an urgent basis. Of course, time is of essence. Do varicose veins lead to heart disease, Preeti? No. So varicose veins are basically a failure of the valves within the veins to push the blood or lead the blood back to the heart. They occur through various conditions. They, of course, have a genetic component where you may have some gene that predisposes those veins to have a somewhat weaker constitution by nature. And then subsequently, there may be aggravating factors such as pregnancy, which puts excessive weight on the pelvis and leads to increased pressure in those veins, which are already weakened, compromising the valves. You may have iatrogenic causes, which implies that we have, performed a bypass, extracted a vein, and subsequently the other veins are trying to compensate and lead to dilatation. And you may have people who are standing for prolonged periods of time, again, putting gravity and weight on veins that are already somewhat weakened and compromised by constitution. And so this itself won't lead to cardiac disease, but can cause other issues such as significant edema of the lower extremities. And I'm going to ask Dr. Langer this question as well.
Actually,
Monica asked, how useful is Sarpagandha in hypertension?
Yes. Actually, in my clinical practice, I never use Sarpagandha in hypertension. Rather than that, I have seen good results of Arjuna and other medicines, but I never tried Sarpagandha in my clinical practice for hypertension. Okay, so I don't know if it is useful, but what I have read that Arjuna is better than Sarpagandha in hypertension. We are left with 10 minutes, so if anyone have any questions, can ask.
I don't know how much of the severe COVID illnesses you guys are seeing in India. I know the numbers are not huge there, but at least in US and Canada, we're seeing pretty big numbers. And some of the pathology, as I mentioned, definitely involves the heart. So we're seeing on presentation that sometimes they'll present with an elevated D-dimer. D-dimer is a non-specific marker of thrombosis. And some of the upcoming clinical trials will be looking at prescribing heparin or other anticoagulation in the early stages to reduce the risk of clotting, which is what we're seeing in many COVID patients. So there's trials involving that. There's also what we found, another non-specific inflammatory marker called CRP is quite elevated in COVID patients. And again, there's certain previous HIV antivirals which are being tested to suppress the virus and reduce inflammation. And they're showing a lot of promise as well. But we do have some pretty intense cardiac presentations of COVID happening across the West here. So Avinash, so the great question. So if a patient had an MI and you're unable to reach the hospital fast, what should be the priority actions to save that patient? So the term MI is such a vague and broad umbrella term of myocardial infarction. So myocardial infarction implies that there is a certain portion of the heart muscle which is died or scarring off because of lack of blood flow. So this could be because of occlusion of a blood vessel, which could be through either a vasospasm, such as Prinzmetal angina, or through a true coronary blockage with a cholesterol plaque buildup and subsequently rupture of the soft portion of the plaque, which then goes from a 20% block to a 100% block in minutes. So when this completely occludes the vessel, that oxygenated blood cannot reach that portion of the heart muscle, and that portion of the heart muscle dies off. And subsequently, the patient may present with, in the early stages, severe chest pain, sweating, or a change in vitals. If it involves the right side of the heart, for instance, where the passive flow is coming through, you may have significant hypotension. But also in later stages, because the heart muscle is missing its oxygen, you may have significant dysrhythmias, such as ventricular tachycardia, or in worse, more fatal situations, ventricular fibrillation. So especially in public settings, it's important that there should be an automated defibrillator present, at least in large gyms, grocery stores, where there may be a huge number of people. And of course, you know, for those who have known cardiac illness, it's nice to have someone trained in CPR at home. So the most important thing here is to restore blood flow as much as possible, because if the heart starts to flutter on the left ventricle, for instance, you have ventricular tachycardia, then the left ventricle is not pumping strong enough to be able to get that blood to all parts of the body, in particular the brain. And within a matter of minutes, you will have significant hypoxia or lack of oxygen to the brain and death of cerebral cells, which can be devastating. So the first thing you want to do in the setting of a cardiac arrhythmia, which you would check by means of pulse, if the pulse is absent, you know that you'd have to assume that there may be a cardiac arrhythmia present. So you immediately perform CPR. So the CPR should be performed briskly, and you know, there are various cycles that have been studied. You can do if you don't have the means to restore oxygen through the breathing, you just continue to do CPR, because it has been shown that aggressive CPR, it can restore blood flow to a reasonable extent. And you can also, if you have in your armamentarium, if you have a low-dose aspirin, this, which would help in thinning any ruptured plaque, should immediately be given, either 81 milligrams, and I think in India you might have it in a dose of 100 or 75 milligrams, but you could give 2 of those low-dose aspirins. Of course, if you're in a more sophisticated center and you have access to more life-saving measures, you could use the automated defibrillator. You could give the patient oxygen. You would give them a dose of morphine to settle the pain, and also this helps to dilate coronaries to some extent, etc. So this from Amar, I'm not sure if you could clarify your question. It says core or CPR 10, which is best. Can you expand on that? And in the meantime, I'm going to answer Ayush's question here. What is the recovery process after a heart attack according to Ayurveda? So actually, Dr. Lungar, I'm going to pose this one to you, because you may have seen more patients in the Ayurvedic perspective after an MI.
I already told you, I have never seen any patient of MI.
Okay, so after a heart attack, according to Ayurveda, of course, you want to follow the basic principles. The patient will be, first and foremost, will be very vata aggravated because they're anxious, psychologically distressed, because many times they come to you very depressed, thinking that their entire life is going to change. They won't be able to do the things that they can do. They're now disabled, etc. So you must tackle the vata aggravation first. And especially being us in the West and always in cold climates and a lot of rush and running around, vata is already aggravated. So this becomes paramount. Secondly, if there's any inflammatory process, for instance, if they've had inflammation at the site of the scar where we did the angiogram, or if they have inflammation of the sternum or the pericardium after the coronary artery bypass, you may need to treat those things either with non-steroidal anti-inflammatories in allopathy, or through Ayurvedic herbs and those herbs which settle down Pitta and Vata aggravations. And of course, in patients who have a heart attack that has led to significant heart failure, dilated cardiomyopathy, and fluid overload or edema, you know that kapha may be playing a role here as well. So again, you want to take a dosha responsive approach based on your patient, and each patient after an MI will present differently. As I was mentioning earlier, you can give only compressions and not mouth-to-mouth respiration, but you must do it continuously and aggressively. This can restore blood flow until such time as you can get the patient to an important tertiary care or a cardiac center.
Vineeta, I think we are not left with any questions. So if you have
Okay.
anything to share, we have only less than 3 minutes now. So if you have anything, less than 3 minutes, yes. If you have anything to share about your experience, experience with Ayurveda, how you join Ayurveda, about Ayurveda college in Canada. So
yes, it's difficult. Honestly, what frustrates me is we have very limited access to herbs here. And usually once we get them, they're sitting in the warehouse for how many years, I don't know. So some of the potency is lost. But we try our best, and I'm hopeful that eventually we'll be able to source our own herbs, at least in Canada, to help with some of the diseases, which would be tremendous. So I trained back in 2014, and we did our best with what resources we had. And so far it's working. It's working, but I tend to use a combination of allopathy and Ayurveda in my current practice, and I find that to be very useful. Of course, if you can manage any disease with any knowledge that you have from any angle, it's important. Scope in Canada, scope for Ayurveda in particular. Of course, we are growing the organization, and we're trying to get some government coverage funding for Ayurvedic clinics, which are currently private paid clinics. But we're trying to get some funding so that we can expand the scope of Ayurveda in Canada. This is an ongoing project. So any help or contributions any of you have would, of course, be appreciated. And we have the Ayurvedic Association of Canada that you may join and keep up to date on what's happening here.
So there is a tough question from my side to you. Which is best, Ayurveda or allopathy?
So they're very different. So Ayurveda, thousands of years old, based on much anecdotal evidence and knowledge of our amazing ancestors, of course, is invaluable. And it has a very spiritual element to it, which is very, very important. Allopathy does not have the spiritual element, of course. But of course, as we mentioned earlier in the question about the MI, sometimes no matter what we do, the patient may succumb to some form of disease due to their own constitution or otherwise. And as such, allopathy becomes important when you're trying to, for instance, open an artery quickly and restore blood flow. So I think a combination of the two is definitely a nice place that we are in today's age. But of course, the foundations of anybody's well-being and health, I believe, should always start with Ayurvedic principles.
Thank you.
Thanks, everyone, for joining.